When patient families think that neurosurgery is going to fix everything in their severely declining loved one, we've seen the movies and things, right, where it's like, oh my gosh, they're crashing, get them to the OR, and then, they'll wake up afterwards. And so many of us have never been in a hospital environment with someone who's severely neurologically compromised. So our only reference point often is movie and TV. And that is such an unrealistic depiction of what happens in the real world. You don't necessarily have someone who's in a coma and and all of a sudden they just wake up and regain consciousness. They have all of their memories, no personality changes, no, deficits. They were asleep for a while and then they woke up and maybe they had surgery or something, but that's not how it works. One of the most common misconceptions I would see is, let's say you have a patient who had an aneurysm rupture, AVM rupture, had, severe, large ischemic stroke with a lot of cerebral edema, and they'd have to go to the OR to maybe repair the aneurysm or maybe create a bone flap for the edema to have some room to swell. And families would think, oh, okay, they're good. I'm glad they're having surgery to fix the problem, and that thinking that will wake the patient up. But important teaching point, if you work with neuro ICU patients, is that surgery is to prevent more damage from occurring, not repairing the damage that has already happened. So let's say this patient came in with a severe ischemic stroke, like a huge one, and they had complete left-sided weakness, and they go in and remove part of the brain, part of the skull to allow for more swelling because the swelling is getting severe. That's not going to make that left-sided weakness paralysis go away at all. It's just going to prevent it from getting worse or more deficits from coming. And these are last-ditch efforts to preserve as much function as possible. So it's a really important teaching point if you get the impression that the family thinks that this is going to be surgery that is going to fix all of the damage that has already occurred. Really, I've found so many times that was a common area where we missed each other in terms of communication and expectation. So I hope that helps with some patient education in the future. Follow for more nurse tips.